Hello everyone, today we are talking about the paired samples t-test. This test, we can do it when we have a sample and we want to test for example the treatment. So we test pre and post the treatment. So let's say we want to test some kind of medicine. So we have a group of people. We test them before they take the medicine and after that. We want to check whether or not this treatment has effect or not. It can be treatment or some kind of exercise or anything that we will apply on our sample. So the hypothesis, the first hypothesis is saying that there is no differences between before the treatment and after the treatment. Before the first sample and the sample after it had some effect. And the alternative hypothesis say that there is differences between before the sample and after the sample taking the medicine or the treatment. So the second hypothesis saying that there is difference, there is a significant difference. So if we saw the p-values, the significance p-value is 0, it means that we take the alternative hypothesis, which telling us that this kind of medicine, this kind of exercise is effective, it has some effect, that this is what doctors or researchers looking for, to have effect, to find an effect, differences between the first sample and the other sample. So let's take an example. For that, a physician is evaluating a new diet for her patients with a family history of heart disease. To test the effectiveness of this diet, 16 patients are placed on the diet for 6 months. Their weights and triglyceride levels are measured before and after the study. And the physician wants to know if either set of measurements has changed. So the physician wants to know if the measurements have changed or not. Sorry for this. So the physician is checking the weights and the levels of triglyceride. We have 16 patients for 6 months. This is before and after. We want to know, to check these two variables. So let's open the diet study.sav from the data file. Now we go to the SPSS. We open the data, which is diet study. Now we have all the variables here. This is the TGs, the first levels of triglyceride. This is like during the 6 months, from 0, 1, 2, like every month or every 40 days. And this is the weight for the patients, their age, the gender. Okay, the patient number, here is the patient number. Now we go to analyze. We want to compare means to paired sample t-test. Now here we choose the first pair of variables that we want to check. So we have first the triglyceride as the first variable, compared with the triglyceride at the final, when it's final tested. So the first it first testing the difference, if there are any changes, any significant differences between these variables. Then we go for the second, we check this is the weight when the first before the diet, and the weight, which is the last one. Okay, this is the confidence interval. Everything is okay. Now we press okay. Now our result has 3 tables. The first one is paired sample statistics, checking that the mean for each variable. So the first variable has a mean of 138. The second, this is the final triglyceride. It's 124. You can see here. The second table, and it shows us the number of number of the sample size, the standard deviation, standard error, mean, and here is the correlation and the significance of the correlation. Now this is the main table. This is checking the significance of the differences between them, between each two variables. So we here find that the difference is 14. The difference between the two means is 14. If we take the difference between this and this one, it would be 14, and the difference between these two means is 8. So we can find there's a big difference here. However, we can't tell that if this difference is significant or not, especially when we have the correlation here is not significant between the first and second triglyceride level. This is not significant correlation, and we can think of that the levels of triglyceride were overall lower for the patients, but the change was inconsistent across subjects or patients. So several patients have lowered their levels of triglyceride, but some others didn't change, or maybe some of them increased their levels. So in overall it's lower, but it's not trustworthy. It's not statistically significant. We don't actually this is the second test for the second pair of variables. We can see here the difference is 8, but the correlation is 0. The significance is 0, which is telling us that this change or this lowered weight is consistent across subjects. Here is the standard deviation. Here is the standard error of means, the lower upper confidence level, the T, the degree of freedom, and here is the main thing that we have to look at. The first one, the significant level is 0.249, which is far from 0.05, so we can't reject the null hypothesis, and the two levels are not changed, or there's no difference between the two levels. However, the second pair show us that a significance level of means are is 0, and we are taking the second hypothesis, telling us that there is differences in the weight for the patients between before and after the 6 months. So the diet is good for the weight, but it's not good for the triglyceride level. We can conclude that by the following: since the significance level value for the change in weights is less than 0.05, you can conclude that the average loss of 8.06 for the weight pound per patient is not due to chance variation and can be attributed to the diet. So it could be, so the diet is good for the patient regarding the weight. And the second conclusion is, however, the significance value greater than 0.10, which is 0.2 something, for change in triglyceride levels show that the diet did not significantly reduce the triglyceride levels. So it's not good for to reduce the triglyceride levels. Thank you for watching. See you in the next video.